think nutrition is the cornerstone of healthful living, and it is that intervention that is supportive of both pharmacological as well as surgical interventions.
In today's increasingly complex world of healthcare, food is often the afterthought, and that's our primary focus. We come to Stanford every single day and we say, how can we use nutrition to improve our patients' outcomes?
Some people misdose.
The clinical nutrition team at Stanford Health Care has many different areas of focus, anywhere from cardiology to solid organ transplant to oncology to endocrinology to primary care. We have over 40 registered dietitians in our inpatient and our outpatient settings.
The big benefit of this collaboration means that it's not a single discipline or department working towards the benefit of the patient. It's a group of departments working together, each utilizing their individual skills to come up with a really great plan of care to enhance recovery and get patients home and safe as quickly as we can.
Malnutrition is actually really hard to identify, and dietitians are trained and equipped to be able to identify this difficult state. Your GI tract pretty much kind of stops working, so it takes a little time for it to wake up after the surgery. So they're at very high risk of becoming malnourished.
You and I have had a history together. Remember the time I fed you through your nose?
On the medicine units, I routinely perform what we call medical nutrition therapy. I identify malnourished patients, provide and oversee nutrition interventions. As a nutrition ambassador, I can be that little voice in your head that says, yes, sustained lifestyle adaptations can produce the results that you're looking for.
Who says we need carbs? My day-to-day really looks different every day. So some days I'm here teaching classes, other days I'm seeing patients one-on-one, but everything ends up being patient-centered. And all the studies really show nutrition is so key to patients' outcomes in the inpatient setting as well as the outpatient setting. The clinical dietitian team is definitely a really special team. Whenever I meet with other people that work and interact with our clinical dietitian team, they always say, wow, your team seems like they have a lot of fun.
I was blown away when I first came here to interview for this position by just the passion and the intelligence and the commitment that my team has to their profession. I was just absolutely blown away.
I love working at Stanford because of the compassion that is here, that's in the energy, the air, within everybody. Everyone is really caring, and it's just such a peaceful and healing environment to be in.
At the end of the day, I always feel the sense of being a nutrition ambassador, because it's not only about disease conditions, but it is the overall well-being that gives me a sense of self-fulfillment.